supported, and we have a good pipeline of care. And then our comms and communications and involvement plans, and that's why my link around that, the partnership boards work earlier. So I won't go through any of the detail in the rest of the pack other than the last slide, and I'll let the partners come in. But the last slide basically describes the change that has happened as a result of the Integrated Care Board restructure, which has been a reduction in our local borough team for the ICB of around 47%. But that has also meant some of our functions have moved to teams that work across North West London now. So, for example, any individual patient commissioning decisions are and work is happening once across North West London with a team that is working across. So that's both for children and adults, which it was more at a local level up until now. Some of our responsibilities around primary care contracting will move to a North West London approach. We will absolutely be involved to make sure that it's serving the needs of our local population, but we will bring in that specialist expertise as and when we need it from that North West London team into a more local level. But the borough-based partnership is across all of us, so we all share responsibility, but the local ICB team has been really supporting a lot of the work streams to progress. And then I'll hand it over to any of our partners who want to add, because I'm sure I haven't done it justice.
Thanks for that. Now, Chris, do you want to say a few words about?
Sure, I'm happy to come in. I mean, I don't particularly want to further expand exactly on what's written in the slides, but it kind of, building on something that Councillor Newstab said earlier on, it feels timely that we are reviewing the progress against the health and wellbeing strategy and providing an update on the work of the borough-based partnership, as well as reflecting on the Better Care Fund in this forum today, which coincides with the same day that Lord Darcy has presented his review or diagnostic review of the NHS. And I guess in that review, he challenges us all to make a shift towards locking in care in community settings, expanding and adapting community and mental health, actually, care closer to home, bedding in the financial flows to support that, providing definitions around integrated care, including using a population health management approach, and the phrase he uses is simplifying the care delivery for a neighbourhood NHS, which fortunately coincide exactly with the priority areas that the borough-based partnership have been working on. So, you know, whilst he might diagnose the NHS as being in a critical condition, the vital signs that he identifies are, I think, visible here in the work that we're doing in Ealing. And I think it's through the partnership work here that we need to take that stimulus, and hopefully haven't yet seen what the Prime Minister said in response, but I'm sure that the policy action that follows to enable us to continue to do the work together.
Anyone else got any comments, questions to Neha, to Chris, to the partnership as a whole?
If I may, yeah, I mean, absolutely. And I mean, I think we have to be cautious of being self-congratulatory, but I think the Prime Minister said no more money without reform. That's basically what he said. But it does feel like we've got the infrastructure and the relationships in place, which in my, you know, I'm fairly new to the role, and my understanding isn't the case in all health and care systems. So yeah, we have a good platform to build on, but obviously there's a long way to go, and there's certainly you know, it is our side of the table, isn't it? Because we're not meant to. Well, Anna's over there, no, but yeah. You know, I mean, there's no argument for us in terms of yeah, community earlier and neighbourhood-based provision and the benefits that can bring, and working together to be able to provide that. It can only bring enormous benefits for our residents.
Just picking on one point you made, Chris, around embedding the flow of financial resources. That is a big challenge in terms of trying to shift resources from our acute trust into the community is very challenging when there's a backdrop of struggles and challenges and difficulties within the trust themselves in terms of waiting times, etc. So it's as the Prime Minister said, no further investment until there's reform. There is reform that can be done, but there also needs to be an understanding about how the distribution of the resources to be able to manage those reforms as well. So that's for all of us to try and work out. Right. Okay. Any questions from anyone else? I think there's one hand up. Joe.
It's me. Yeah. So thank you, Vijay, and thank you, Neha, for presenting. I suppose as a member of the partnership group, when I look at some of the work we're doing in the urgent and emergency care field, a lot of the work we're trying to do is in community and is about trying to get upstream and or support downstream kind of patients in the community, from the mental health beds through to our care home teams, etc. So I think there's good examples already in some of the work we're doing in partnership about where there are gaps and where there are things we need to put in place to try and help and support in the community services, homeless team, etc., that we pick up and identify, but actually the whole of their journey largely sits in community, and what we hopefully are is a service that just allows them to get back out to that space. But that I think has been a large focus of what we've done, and I hope we see much more of this sort of work happening moving forwards.
Thank you very much for that, Joe. Any final comments from anyone? No? Great. Thank you very much, Neha, Chris, and others in the Borough Pays Partnership for that. Right. Okay. So we've come to the end of the items on the agenda. We've had 4 questions that have been submitted by the public. 2 from Roy Willis and 2 from Michael Geoghegan. Michael Geoghegan is unable to attend this afternoon, but we'll go to Roy's questions first. Roy, your second question around in terms of the care line, he's answered. Yeah, I was going to say it. Yeah, he's answered that question. But in terms of your first question, Roy, that you submitted, have you answered? Have we gone for both of those questions? Great. Okay. And in terms of Michael's question, let me just read out the question. The first question was related to the item number 6 in our minutes of our last meeting in terms of immunisation and the experiences, and it was related to, the question was around for you, David, in terms of to break the survey results down further into areas and ethnicity, which later on seems to accept. Is the board monitoring David's progress on this, considering that Ealing has a population of circa 400,000? I would like to know how he would use statistical theory to give significant answers to this request. So we will give us a written response to Michael regarding that one. Yep. And then the second question is around the carbon zero aspirations of the council, and again we have submitted a written response back to Michael from Alison Parry on that one. Right. Okay. So we've come to the end of our Health and Wellbeing Board meeting, and we are we've got 14 minutes back, so that's pretty good. Our next meeting is on Thursday, 23rd of January, and our expectation is that it will be again in the afternoon. So thank you very much for everyone's attendance and contributions, and also to all of the papers that were submitted for the Health and Wellbeing Board. And I know that there's a lot of work that happens in the background to get these papers produced and submitted on time. So thank you very much for everyone's contributions, and have a wonderful evening.